A controversial bill returns to Beacon Hill as state lawmakers hear a proposal that would allow doctors to prescribe medication to terminally ill patients to end their own lives. Under the bill, Massachusetts residents who have a diagnosis of less than 6 months to live would be able to request life-ending medication from their physician. Supporters of the bill say it comes down to choice and compassion. Janet Folger lost her husband Dave to pancreatic cancer in April. She said she and Dave seriously considered moving to Vermont, where medical aid in dying is already legal. But Dave's condition deteriorated too quickly.
If my husband had had the option of taking medication that would have allowed him to sort of slip away calmly as opposed to being agitated and delirious and crying out in pain, it would have given him and his family comfort, and it wouldn't have diminished the life of somebody else.
Holly Breyer says her mom was given the option to stop taking nutrition and water after her body cruelly rejected a bone marrow transplant during treatment for leukemia. Doctors thought she would die within 3 days.
10 days, and she was in pain the entire time. She was very sick, and her skin was looked like burns all over her body. We were there day and night, so we know she wasn't comfortable because every time they would move her, she was moaning, she was in pain.
The Massachusetts Medical Society recently polled doctors across the state on their opinion of medical aid in dying. Some doctors, like Dr. Ellen Steinbach, are already in favor.
If they're in terrible pain, mentally or physically, and they have a terminal condition, one that everyone agrees is probably going to cause their death, I think they should be able to choose how they die.
But there are concerns with the proposal, especially when it comes to medical insurance and elder abuse. John Kelly is director of Second Thoughts, a disability rights group that opposes aid in dying laws.
There are just too many dangers to this bill. We say let's meet people's needs rather than throwing the patient out with the bathwater.
If the bill gets out of committee, Massachusetts will be one step closer to joining several other states that have already legalized medical aid in dying. But the measure failed on the ballot in 2012, and in a decade it has never made it past early legislative stages. Compassionate Choices, the advocacy group behind the legislation, says they're hopeful for this particular draft.
The time for this legislation has come. There are people right now who are desperately in need of this option.
Reporting for the Boston Herald, Meghan Ottolini.